Hey everybody, Dr. Patrick McGrath here from the Foglio Family Foundation Residential Treatment Center, part of Amita Health, and today we're answering some very basic questions about OCD, like what is it, and what's an obsession, what's a compulsion, and next we wanted to get into what are some of the common types of OCD. So I've got my list of questions and some of my notes here, so don't mind me if I check back on some of them because I want to make sure that I hit all of these as I possibly can. So number one is checking. And why would somebody do checking? Well, because their OCD is all about doubt. I mean, if you think of the nickname of OCD, it's the doubting disorder. And so if I doubt as to whether I close the door enough or I shut the refrigerator all the way and think, well, then I could be responsible for all the food going bad, or what if I didn't quite lock the door to the window or lock the door or the window enough, and then somebody breaks in and does something bad or awful to me or my family or my pets. That would be horrible. Or what if my pets get out because I left the door ajar a little bit and now they're lost and then they get hit by a car and then people will hate me because I should have just closed the door and now I'm responsible for the death of my pet, and all of the worst case scenarios that anybody could potentially run. That's what somebody with OCD is going to do. Believe them to be pretty likely to be true, and therefore keep doing all of the things that they keep doing, like checking, in order to make sure that that door is locked, that refrigerator is closed, that window is shut all the way, just to be 100% sure that everything's okay. The problem, of course, with that is OCD has never allowed anyone to feel 100% sure. So we have this goal that's unattainable, and we keep striving to achieve the unattainable goal. So all we do is keep getting disappointed because we never attain the thing that we can't actually attain because it's unattainable. Well, there's the kind of crux of this. In fact, the Greeks wrote a myth about it. It's called Sisyphus. Sisyphus was condemned to Hades because he had done something that angered the gods, but the gods played a little trick on him, and they told him, if you get that stone over there up that tall hill and get it to the top, we'll let you out of Hades and you can become a demigod. The trick was the stone was about 1 pound too heavy for him to be able to get it all the way to the top, and the hill was about 1 degree too steep to him to get that stone up there. So just as he's about it to the top, the stone rolls back down, and he goes back and he does it again. And he spends eternity just trying to get this stone up to the top of the hill, believing this time might be the time I get it, always being dissatisfied and never achieving it. And that's kind of what OCD does to people as well, too. Next is washing. So this could be a fear of contamination, a fear that maybe there's a germ on me that could get into me, or a fear that I could pass that germ on to someone else and make someone else sick, or all the way up to like harming somebody if I don't decontaminate something. I mean, what if somebody were to sit on something and I as a man sat there and somehow, some way, who knows, sperm got onto the seat, and then a woman sat there and now that sperm somehow gets inside of her and she becomes pregnant, and oh my gosh, she's having a baby, it's my fault, and I should have washed myself more just to make sure that that didn't happen. And as ludicrous as that one might sound to you, I treat that one a lot. We get a lot of people who have that kind of belief. And the really fascinating piece that I think about that is that the person who's telling me that story can look at me and say, believe me, Dr. McGrath, logically, I know this is ridiculous. This is not going to happen. But then they always say the two words that really indicate anxiety and OCD to me, and those words are, what if it does though? Or if it's 4 words, it's, yeah, but what if it does, right? So you're gonna have, but what if, or yeah, but what if, but that what if is going to be in there. And that's really what OCD thrives on, is it thrives on those 2 words, what if. And in the world of what if, OCD can make anything potentially possible, and everything then can become a what if. So we definitely see people believing things they know to be logically illogical. But what if this time, for some reason, somehow, some way, it came true, it would be my fault, it would be awful, it would be horrible, people would hate me or blame me, I could get arrested or go to jail or something like that. And I just want to keep doing these things just to neutralize that, to be sure that that doesn't actually occur. Okay. Next, we'd see praying. Why might somebody do praying? Well, Maybe they have something that's called scrupulosity. Scrupulosity is OCD about morals or ethics or religion. And so maybe the belief is that they've had a thought or an image or an urge that goes against something that their higher power would be okay with. And therefore, they need to say a prayer to ask forgiveness for that thing. Otherwise, they will be condemned by that higher power. Now, the interesting thing about scrupulosity is that people with scrupulosity typically tell me that they believe that their God, their higher power, is almighty, all-knowing, and yet they keep doing OCD behaviors for reassurance because their OCD convinces them that maybe their higher power doesn't know what OCD is, and therefore they have to keep reminding this higher power that, hey, I didn't actually mean that, I have OCD, so just want you to know that and please forgive me for it. I don't care how strong a belief anyone has in any form of religion at all, OCD can screw with it and make you doubt it, okay? Because that is just the nature of OCD. Someone could hand you a pile of gold and you might doubt if that's actually gold, right? I mean, which sounds ridiculous because there it is right in front of you. And then they could test it and they can put, they could drill into it and you could see it's gold. There's no steel in the middle. They didn't form gold around something else. All the tests, they could chemically analyze it. They could show you graphs and figures and all sorts of things. And you would still doubt it. And OCD is the same way. It doesn't matter what kind of proof anyone has, you're still going to doubt it. And if your goal is going to be that you need 100% proof, then you're never going to achieve your goal because you can't, because you can never be 100% sure. And so we want people to live with doubt. And so for some people, they say, well, I can live with doubt during my life, but with scrupulosity, what if I die and then I discover I've done something wrong after I die and then I spend eternity in damnation or something like that? So I need to spend my whole life making sure that that doesn't happen. And then people are always searching for all sorts of things that they've constantly done wrong. If they're Catholic, they might go to confession every day just to ask the priest if it's okay. Confessing is just another kind of compulsion that many people do too. Even if they're not Catholic, they might run it past friends or family. Hey, I did this or I thought this. Do you think it's okay? Would you be okay if you had this thought? Oh my gosh, you wouldn't. So what should I do to neutralize it? Should I do to make it go away? Please forgive me for having this thought about you. I'm so sorry. And this constant reassurance seeking that people do through confessing, but also hoping that in confessing something to someone, they'll say to you, don't worry about it, it's fine or okay, which feels great. But then you doubt if they really knew what they were talking about. So then you want to confess it to someone else and hope they give you the same answer. And after a while, you doubt if they know what they're talking about, and then you do it. And here's the thing. You could confess to 100 people, and 99 could say, I wouldn't worry about it. But one could say, I think that might be kind of bad. And you're going to take the 99 who said don't worry about it, and you're going to throw them out. And you're going to look at the one person who said to you, I think you might need to worry about that. And you're going to trust their judgment and believe that they are right, they are correct, and everyone else is wrong. So there's a lot of selectiveness that goes along with this as well too. Symmetry. I have to put things in a certain way or order or place, or else I can't deal with it. I can't go to work if there's a cup that's sitting in the wrong spot, either in the sink or on the counter. The cups want to be with the cups, which are up in the cupboards. That's where they belong. So how can I get my work done or spend my day doing anything knowing that there's something out of place or out of whack, right? There's some treatment centers that I love. They have purposely hung pictures sideways and crooked on the walls just to really kind of get people with OCD to have to sit with that discomfort and recognize that, they can handle that. That's all right. They don't need to do anything to try to make that go away, but they can sit with the discomfort of knowing that something is not in the right order, something is not in the right place, and I have to just be able to learn to live with it and not do something about it. Because there could be a belief that if things are not in the right order or place, that could lead to something going wrong. So people might straighten things with symmetry. They might put things in order of color by the rainbow. They might put things in order by alphabetical. They might have to match their hangers with the color clothes that the hanger's on. All sorts of things that people will do that might be hours and hours and hours of time. In fact, one person, I loved working with her, who got her dining room set up to exactly the way that she wanted it, from the place settings and the silverware. She had rulers out to make sure that every place setting was exactly 12 inches apart from the one next to it. She rulered out how far the glass was to the right of the plate, and what the fake plant in the middle was, and trimmed it so that it was evenly distributed around the table. And then no one was ever allowed to use her dining room. So it became a room that was totally useless, because once they used it, they would screw it up, and she had spent months getting it organized to be exactly the way that she wanted it to be. And I talked to her about, well, you might as well put one of those gold posts and then the red velvet rope there to the entrance of it. And it's kind of like walking through, say, like Lincoln's childhood home or something, where everybody can walk into one area and then kind of lean over the rope and look in the room, but no one's actually allowed in to touch it, because we wouldn't want to destroy this masterpiece that has just been created in this room. That would be awful and horrible if that were to happen. Sometimes people will touch things over and over again to make sure that they know that it's there, or it might even be like a light switch. Turn it on to make sure the lights are on, and then turn it off. All right, that's off, but then start doubting if that's really off, so then they'll turn it on again. Okay, so that's what it looks like when it's on. All right, turn it off again. But there's a light from the window too. So does that mean, is that light coming from the window or the light bulb? Even though the light bulb looks darker, well, I'll turn it on. Okay, so that's really bright. And this doubting that goes on. So I have to keep kind of switching these things, or touch the door handle or the stove handle. That could be part of checking then, to really make sure that even though I'm looking at it and it looks to me like it's 90 degrees and the gas is off, I'm going to still touch it and turn it to make sure. And then what unfortunately happens a lot of times is people break things because they've touched it or pushed it or pulled it so many times that now they have to call a locksmith out to come and put a new door in, or a new lock in the door, or they need new knobs on their stove because they've turned them so tightly that they've cracked them. And that becomes a lot of money over time, potentially too, that people have to spend because of all the extra touching of things that they do. They might want you to repeat something that you've said just to make sure that they've heard it right. So you might notice that when you're talking with someone with OCD, there's like, could you just say that one more time? Or did I hear you right saying that? That's constant reassurance that they're actually being there fully present in the conversation. And one of the reasons why they're often not fully present in the conversation is they're constantly doing obsessions in their head or compulsions in their head. So they actually aren't fully engaging in the conversation. And then they realize you've said something and now they haven't fully heard you or listened to you. So now they want to make sure that they do that, because if they don't, they might have missed something. And that would be horrible if they missed something, because, well, what if that turns into something bad because they missed it? So now they want you to repeat it over and over again. Or they may repeat things that you said or that they say to you just to make sure that you have been 100% sure that you've heard them correctly as well too. There's also some phrases that people a lot of times with anxiety and OCD say. One of my favorite ones is, "I'm sorry." Maybe you've had a conversation with someone who come in and you say, "Hey, I'm sorry. I just I just wanted to ask you a question. Sorry about that. But could you just remind me if this happened?" And sorry, thanks, sorry for your time. Thank you, sorry, bye. And I've gotten to the point with many of my patients that I have said, I no longer accept your apology. So you can tell me all you want how sorry you are about something. I won't accept it, because I'm not going to give in to this ritual that you keep doing of believing that maybe you've done something that's offended me and that you're apologizing for it, because that's just going to perpetuate more and more OCD behaviors over time. So I'm not going to accept your apologies anymore. Now, this can come down to a lot of reassurance seeking that people do. And of course, that's huge with OCD, constantly wanting to be reassured that everything's going to be fine or okay, which could be by the acts or behaviors that I do, be they physical, like I now really do feel like I've locked the door, or mental, I now feel like I've prayed enough and God's okay with whatever it was that I might have done or not done. But I have to keep repeating it until it feels just right. And that's another phrase that we very often hear in OCD, this notion of just right. And just right today might take 3 times, and tomorrow might take 74 times in order to feel just right. Just right is a constantly moving target, and it all depends really on how we feel emotionally before we are comfortable enough with something feeling that it was done just right. We've talked a little about scrupulosity, so I won't go too much more into that, but remember it's about morals or ethics or religion. So it could be that I've offended you or I've said something wrong to you and that I want to apologize to you, and it could go all the way up to religion and higher powers. It could even involve blasphemous things too, where what if while reading some holy scripture I have an intrusive swear word or something pop into my head, and now I've associated that swear word with scripture, and now I have to unthink that swear word and reread that scripture until I can read it without having the swear word pop in my head. Or it could be thinking about deity naked or something of that nature, and that's awful or horrible. Now I have to unthink that thought, or I have to say a bunch of prayers in order to unthink it. And it could even be about, what if I have horrible, awful, bad thoughts about my family members, which could lead into even harm thoughts, which is probably lately where OCD's really shining. We used to think of it mostly as contaminations and symmetry and checking and germs, but now I would say what we see more than anything about OCD is the harm thought piece of what if I were to harm someone? What if I were to do awful or horrible things, say to a child, and become a pedophile? Or what if I were to become a sexual identity that's different than the identity that I define myself as? So if I'm gay, what if I became straight? If I'm straight, what if I become gay, or I really am and I just don't know it? And I'm married and I have this partner, and then one day they're going to find out and I'm going to have ruined their lives because I was living this lie and didn't tell them what I really am. And that can be combined with harm thoughts too. So I might harm a child and do things bad or awful sexually with them, and it can just ramp up all over the place. So maybe it's best if I just don't interact with people or stay away from everybody, because only then am I going to be sure that these thoughts won't pop into my head. And of course I believe that because these thoughts pop in my head, they make me maybe more likely to want to do them, or these things actually happening as well too. And then along with a lot of these things, of course, is going to come stuff like depression. Substance use can be very common, suicidal ideation or thoughts, and even suicide attempts or completed suicides happen with OCD more than they do in people who don't have OCD by statistically by percentage and things. So it's a very serious disorder. The World Health Organization has said OCD is one of the top 10 most disabling disorders in the world. But the good news is that it's treatable. And my goal for anybody watching this would be, I hope that what I've gone over today has helped you to recognize that maybe you might actually have OCD, because I've touched on something that's going on in your head. But I want you to know the hope that it's treatable, and there's lots of great therapy out there, especially exposure and response prevention therapy, which we do here at our different levels of treatment: intensive outpatient, partial hospitalization, and at residential treatment through AMITA. And you can be helped, and know that. And if you want some good basic kind of Q&A stuff about OCD, I have a book out called the OCD Answer Book, and there's tons of good information in there about OCD and just basic questions that I polled everyone I could think of. What did they want to know about OCD? And I wrote those questions down and then wrote answers to them so that it would be helpful to people with OCD, their families, and the general population too. So if I see you again in some webinars, I hope to, because I've really enjoyed these discussions with you today and look forward to having more of them with you in the future. Thanks.